Hello. Hello, I'd like to welcome everyone to the Tuesday, October 26th meeting of the Health and Education Committee. Our first order of business is to approve the minutes from our past meeting.
Madam Chairman, I find the minutes to be in order, and without objection, I move for their approval.
Thank you.
Second.
All in favor, please say aye.
Aye.
Any opposed? Very good, thank you. All right, Health Department, welcome.
Mayor Ketron, Madam Chairman, and Commissioners of the committee, good evening. Tonight I will be presenting the Health Department report of community health outreach and providing COVID-19 updates. At this time, will you please take a look at the September 2021 report of community health outreach. As you see, our three columns labeled Protect, Promote, and Improve continue to increase as our staff continues to provide education and guidance regarding COVID-19, but then also regarding our health services that we're providing at the Health Department. I'm also excited to share that our outreach team will be allowed to go back out into the community with restrictions to be able to provide more outreach with outreach, community events, and employee wellness. Additionally, our health education team has been working with diabetes and blood pressure regulation pamphlets distribution, breast cancer awareness pamphlets distribution, and COVID-19 response activities. I also would like to draw your attention to an event that we will be hosting coming up. So it's the 4th consecutive year the Tennessee County Health Departments are holding a special Flight Flu Day vaccine event in every county on November the 9th to increase the number of people vaccinated across Tennessee. Our event will take place in the conference room at the Rutherford County Health Department Murfreesboro office on November the 9th from 9 a.m. to 2 p.m. No appointment is needed to receive a free flu vaccine during this event. Once again, Flight Flu Day, Murfreesboro Rutherford County Health Department office, November the 9th from 9 a.m. to 2 p.m. Now, getting into our COVID-19 updates, our drive-through testing will continue to be available Monday through Friday from 8:30 a.m. to 12 p.m. at the former State Farm Operations Building. Additionally, we are handing out Everlywell self-test kits, which are also available at both of our health departments and at State Farm. Furthermore, since our last meeting, the Rutherford County Health Department, along with the City of Laverne and CH Consulting Solutions, are also partnering to offer COVID-19 testing on the north end of the county. Testing started on October the 11th at the Laverne Multipurpose Building parking lot located at 5093 Murfreesboro Road and will be used as a COVID-19 drive-through testing site Monday through Friday from 8 a.m. to 4 p.m. Additionally, we are excited because we're also able to offer weekend testing as well on Saturdays and Sundays from 10 a.m. to 3 p.m. here in Laverne. We want to make sure that we did make COVID-19 testing free and accessible to all residents here in our county, and so we're excited to be able to partner with CH Consulting Solutions. CH Consulting Solutions is a Nashville-based organization, emergency medicine provider offering oral swabs testing with a 1 to 2 day result turnaround, Monday through Friday, and 2 to 4 day turnaround on Saturdays and Sundays. All testing will be conducted and managed by CH Consulting Solutions at this location. Along with testing, we do continue to work all public health investigation that goes along with all positive cases and their contacts 7 days a week. According to the Tennessee Department of Health dashboard, Rutherford County over the last 7 days averaged a positivity percentage of 8.5. Currently, we have 756 active cases with 55 new cases today. These numbers are actually half of what we were last month, so I'm very excited to see these numbers are declining. Furthermore, we will continue to work with our amazing city and county public information officers to help with consistent and clear messaging and information to be shared via social media, our city and county TVs, and with other community partners. Also, in an ongoing effort, we will also work to maximize outreach and access for testing and vaccinations. We will continue to support and work along with our school systems, universities, churches, workplaces, and community groups to provide education and guidance. Furthermore, as we look at vaccinations, the Rutherford County Health Department has begun offering Pfizer booster doses of COVID-19 to certain populations as of yesterday, Monday, October the 25th. For individuals who received Pfizer or Moderna COVID-19 vaccine, the following groups are eligible for a booster shot 6 months or more after they complete the initial series. And you have this information in front of you that we provided in a graph form. 65 years of age and older, anyone ages 18 who live in long-term care settings, have underlying medical conditions, and also who work in high-risk settings. Individuals who are 18 years and older and receive the single shot of Johnson & Johnson vaccine, a booster dose is recommended at 2 or more months after the initial vaccine. I do want to take this time to note that it's preferred but not required to stick with the same manufacturer. Once again, it's preferred but not required. So if you receive Johnson & Johnson, you can get Moderna. If you receive Moderna, you can get Johnson & Johnson, and then also with Pfizer. So you can switch up for your booster vaccine. Additionally, eligible individuals may choose to receive a booster dose, and more information is available at the CDC's recommendation on CDC coronavirus /2019. Currently at the Rutherford County Health Department, we are only offering the Pfizer vaccine booster doses. Our hours of operation at State Farm are Monday through Friday from 8:30 a.m. to 12 and 1:30 p.m. to 3 p.m. Once again, this is located at the State Farm Operations Center located at 2500 Memorial Boulevard. Individuals are encouraged to check vaccine.gov to find a location that is offering their preferred COVID-19 vaccination. We do understand that some people want to stick with their same manufacturer, so if they receive Moderna and they want to receive a Moderna booster shot, they can go to vaccines.gov in order to locate a location here in our county to be able to receive that Moderna vaccine. But currently, the Rutherford County Health Department only has Pfizer vaccine that we're administering at this time. Of course, at our health department, as always, our appointments are encouraged but not required. Booster vaccines are also widely available throughout our county at different pharmacies, medical clinics, and other sites. I looked today, and it seems like we have about 25 sites that are within a 25-mile radius of our health department that are offering Moderna vaccinations. As a reminder, once again, all vaccinations are free. As of yesterday, the number of single vaccines reported in our county was a little bit over 327,000, and out of all eligible residents 12 years of age and older, Rutherford County has about 51% that's been vaccinated. We did receive some information literally right before we walked into this meeting about the Pfizer pediatric age group of 5 to 11, which was being discussed today, and so I believe that was passed, and so we have some additional steps that we'll take before we start administering that vaccine to the 5 to 11 age group. Finally, as we move into the fall season, I do want to encourage and remind us all of the 3 W's: wearing a mask, washing our hands, and watching our distance. And then also the 3 C's of avoiding crowds, close contacts, and confined spaces. Dr. Mack will provide us with additional information regarding the booster vaccine, also the 3rd dose vaccine, and any additional information that you may need in regards to the actual dosage amounts for those vaccinations, which is also provided on the handout that I provided for you all today.
So with regard to the booster vaccines, Moderna is a 0.25 shot. It's a half dose. I got mine on the weekend and really had absolutely no side effects at all from it. Nothing, not even a sore arm. It was great. So the thing is, the guidelines are not very structured if you read them, which LaShann just read. It's pretty much, they don't ask you anything at the pharmacy. They don't expect you to prove that you're in any of those groups. So I think if you're interested in getting your vaccine, there should be no barriers to that. If you're in a high-risk setting, which would be any kind of congregational setting, that would be a reason to get a vaccine. The studies are pretty good, showing that the boosting of the protection is significant, especially Pfizer. Pfizer hasn't done as well as Moderna, but having the 3rd shot is going to make a difference. The J&J, I think you went over already. I know there's some mix and match people, but like I said, I got mine at the local Publix, and they will not mix and match. They told me, if you did Moderna, you're going to get Moderna. And they have Moderna. And that's what most of us got. So it's a little bit of I can't really guide you on whether you should mix or match, but the studies have shown that the effectiveness is pretty much the same. So if you're willing to get your third shot, they're ready. In terms of the other vaccines, the non-booster, for those people that are immune compromised, I don't know if they plan to do more. I think some people are looking at, some people that are on those biologic treatments for things such as inflammatory bowel disease, rheumatoid arthritis, they have gone to get antibodies after their second shot, and some people have found they had none. So those actual medications can inhibit antibody formation, so that's why the third shot happened for them. And the jury's still out whether the third shot makes the difference, and that was a full dose, not the 0.25. So that's the other difference between the third shot with Moderna. Boosters get half a dose, the other folks get the full dose because they need more immunity. It's ever changing, every day it changes. It's kind of hard to keep up, because like you walk out the door and it's like, oh, well, this just changed. But the CDC is a good site to keep you up to date.
Very good, thank you. Are there any questions for the Health Department? Excellent job, ladies. Thank you so much.
Thank you.
Thank
Yes,
you.
good evening.
Thank you.
Thank you.
I will entertain a motion to accept the report.
Move to
the
approve.
report. Second.
All in favor, please say aye. Aye. Any opposed? Very good, thank you. All right, community care, Mayor?
Thank you, Madam Chairman. Members of the committee, our current census at community care is 95, and we're continuing to get new enrollments, which is very encouraging. Revenue for August exceeded the budget amount for the new fiscal year by $242,000. So, and referrals remain high, so it shows that we're in the black. Looks good. Expenses were a little bit higher for August because we had some staffing challenges. We are still in the process of remodeling. We've had some issues with COVID on the workers that are coming into the wing that we're currently remodeling, what we call F neighborhood, but those are still continuing on. Our daycare center is up to 21 students. We're licensed up to 25, so that's remaining solid. National Machine is, if you recall, we had a hot water heater that went out, a large commercial hot water heater. It took a while to get one in place. We were having to shuttle some of our residents from one end of the nursing home to the other so they could get hot water. That's just not acceptable, but however, because of supply chain issues, it was hard getting that hot water heater in and installed. So I approached the board and felt like that we were able to locate, National Machine was able to locate another one because the one that went out is the same age as the second one that we have. And we felt like that it's just a matter of time, and we don't know where the supply chain is going to leave us. So if there's one in Nashville, we went ahead and purchased the other one, even though it hasn't gone out yet. But that way we feel secure that we'll have two brand new hot water heaters for the whole complex. The board went ahead and authorized International Fire. They put it out to bid, International Fire Protection. They're installing a new fire system. The quote came in at $126,632. We had our dishwasher in the kitchen went out, so they decided to put in a new dishwasher and remodel. When they pulled the old one out, it was pretty funky looking behind that. But it had never been touched and cleaned and anything else, so it just, it's like remodeling the house. You pull something out and you can go on, well, that needs to be taken care of, and then that leads to something else. So I think we've addressed all that issue and cleaned up that area of the kitchen. I think this coming Friday, October the 29th, is the trunk or treat. If anybody wants to go out between 5 o'clock and 7 o'clock, if you want to dress up, Commissioner Cook, she'll lead the way since she's on the board. And I think the patients will enjoy a little trunk and treat this coming Friday. Without any other questions, that concludes the report, Madam Chair.
Are there any questions for the mayor? All right, we'll entertain a motion to approve the report. All in favor, please say aye. Any opposed? No. Very good. Thank you. Ms. Jolly, special projects. Welcome.
Thank you. On the last page of the report, the source of funds, I've added the money that from the 2021A series that went through on September the 1st. So now the projects don't show that they're underfunded. The Rockville Elementary, the Rockville Middle, and the Smyrna Middle renovation, and the high school project. And everything else is just paying of the bills.
Like looking at your checkbook every month, money in, money out.
Yep.
Any questions for Ms. Jolly? Give us a roll call, just. Blair.
Commissioner Cook? Yes. Commissioner Blair?
Yes.
Commissioner Key?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Chairman Allen?
Yes, thank you. Thank you, Ms. Jolly. All right, school board. Welcome, gentlemen.
Good afternoon, everyone. All right, first of all, I think it was last month, maybe been longer than that, we came forward with the application from the charter school, Rethink Forward. The board did deny that, and we got back today. We did get back a reply back from the commission, the Charter School Commission, in terms of what our next steps are. We've got 5 days to present them with the information that we created once we did go over the application. Now, I want to start by saying that we're not against school choice. In fact, we've got a lot of school choices within our district. We've got our middle years college academy. We've got our IB program. We've got our BCA over Blackman Collegiate Academy over Blackman High School, and we've got our Cambridge Academy at Smyrna High School. So what I'm trying to say here is we don't have, we're not against this, but we do have some issues in terms of the board, in which is comprised of no citizen of Rutherford County. Typically, when you look at your charter schools, and I've gone through that today, looked at those in Hamilton County, those in Knox, and those in Metro, they are comprised primarily of citizens of that community. Well, this one does not. So I'm asking, and if you'll bear with me, I'm going to read this resolution, and what we're going to request is if the commission can get on board with it, but afterwards you can ask all the questions you want. Whereas the Rutherford County Board of Education has reviewed the charter application of the Rutherford County Collegiate Prep Charter School and subsequently denied the initial charter application and the amended application, as this application does not meet or exceed the standards of the Tennessee Department of Education application scoring rubric. Specifically, none of the three applicable portions of the amended application, the academic plan, the operations plan, or the financial plan meet or exceed the Tennessee Department of Education standards. Whereas the Rutherford County Health Education Committee reviewed financial information from the application that was submitted by the charter school with the Rutherford County Director of Schools and Assistant Superintendent of Budget and Finance, it was noted that the applicant's proposed charter school in Rutherford County would have a substantial negative fiscal impact on the Rutherford County school system by virtue of the applicant's plan requiring immediate funding immediate funding from the county taxpayers to stay solvent and may require additional funds on an emergency basis if the school enrollment does not materialize quickly at the beginning of the school year as budgeted, which creates uncertainty for the budget that the Rutherford County Board of Education and Rutherford County Commission has for its existing public schools. Further, funding the charter school would divert approximately $4.8 million in state and local tax dollars away from the Rutherford County school system in its first year of operation, and would increase by a total of over $32 million in the state and local tax dollars in the first 5 years of the charter school operation, during a time where the county school system is facing rapid student growth and high demand of fiscal funds to maintain the state-mandated operations. Whereas it appears that not a single board member of Rethink Forward, the charter school operator, is a Rutherford County resident. Further evidence of lack of support, as there is no local leadership on the charter school board. This is notable in that the applicant will be requesting millions of dollars of local tax funding over the next several years. Now, therefore, be it resolved by a voted Rutherford County School Board meeting in regular session in Murfreesboro, Tennessee, in the 5th day of November of 2021, and Rutherford County Legislative Body meeting in regular session in Murfreesboro, Tennessee on the 18th day of November of 2021, that the following. Section 1, while the Rutherford County Board of Education and the Rutherford County Commission are not opposed to school choice in Rutherford County, the lack of local leadership of specific charter schools board, along with other above-noted items, is a great concern and leads both elected bodies to formally request that the Tennessee Charter School Commission reject the appeal of the Rutherford County Collegiate Prep Charter application. Section 2, that our state delegation is requested to consider introducing legislation that would require any charter seeking to operate in Rutherford County to have a majority of their charter school board be residents of Rutherford County, Tennessee. Section 3, that the Rutherford County Clerk mail a copy of this approved resolution to the Tennessee Charter School Commission and each of our county's state delegates. And like I said, we're not opposed. It's just some things within the charter application that we had concerns with, we still have concerns with. We'll be replying back to them the next 5 days.
Commissioner Gurley?
Yeah, I was looking at this last night, or actually yesterday afternoon, and when we got it, and you know, it really kind of amazes me that here is a body able to be created that can draw on tax revenues. It's like we start some kind of private security agency that's going to all of a sudden pull from the sheriff's department budget to do their thing. But no one working for that agency or controlling that agency is in Rutherford County. So to me, it's, and once again, I'm all for school choice. I battled it out at times 20-something years ago with the school system to get the needs for my daughter that were needed, and I was the parent and I was the advocate, and so you know there are unique needs for unique students on all across the spectrum, and I recognize that. But this, to me, just almost, it amounts to taxation without representation. Someone's able to spend our money that are not elected, that are from off, who knows where. I don't know where. I haven't looked. I don't really care as long as they're outside of Rutherford County. They don't need to be making the decisions for Rutherford County students. And so this amounts to being able to tap into Rutherford County revenues, really amounts to taxation without representation.
Commissioner Blair?
My time on the school board and now as a commissioner, my philosophy has not changed. As a school board member, my opinion was that if a charter school application could meet or exceed the needs of one of our, or a group of our students, I would be supportive. But as Mr. Spurlock has noted in the resolution, this entity does not meet, and it certainly does not exceed the expectations of what we desire for our students here in Rutherford County. And Mr. Spurlock, I appreciate you and the board being as detailed in dissecting this group, and it certainly is not going to be something that would be positive for our students. So thank you.
You know, one other thing is their close proximity. If they're in the northern end of the county, technically they could have students come over from close to Metro, in the Metro area, and we would still have to fund those students with taxpayer money.
Mr. Phillips?
I've heard.
No, ma'am.
I've heard several comments about we're not against charter schools, and let me just say that I don't know if any of us are against charter schools, and that's not the question. The question is this application, and that's what I want to address. Doesn't the whole system require a need? And I don't see anything in that resolution where they didn't meet the need. We don't have failing schools, not a single solitary one. Should not that be included in the resolution?
I think so, and that's a great statement there. This resolution is not complete. I mean, we brought that forward tonight, but we still got our attorneys looking over it, and we'll be adding things to it.
We've heard for years about some school systems that were really having some pretty serious problems, and charter schools would probably be an answer to some of their problems, but those problems do not exist in Rutherford County, in my mind. The application does not even meet the criteria established for the charter schools, and if I understand that correctly, I would strongly encourage that wording be placed in there. Once again, this is not we're against or for charter schools. This is only for this application, and in my mind, it doesn't even come close to meeting the criteria.
And that was actually, Commissioner, in our reply back, that was one of the bullet points about what you just stated. Mm-hmm.
I think that's an excellent point, Commissioner Phillips. And so not only do we need to add about we don't have failing schools, I think we should also emphasize, when we reviewed this, you went over it for us, I know, July, I think it was, and we spent a lot of time going over that application. I think it's important to point out that this particular applicant, that application was ill-prepared. It was, not only was it sloppy, but it was scary in terms of how it didn't even meet the same sort of financial thresholds that we're held to. So it's a double standard, and we're being asked to fund it, in advance. So I think all those are some really clear-cut points. We don't need to mince words. If there are specific things about this applicant that we can identify where because I think you told me they resubmitted and they still made mistakes. There were still errors on the resubmitted application. They didn't really do anything other than just resubmit.
One of the notes that Ms. Allen noted was when they sent the charter school application in, it was addressed to Metro Nashville school system, and of course we noted that was just an oversight, I'm sure, of their part, since they were applying in Metro and other things. And but then on the amended charter application, they left it as Metro Nashville. So.
Quite frankly, it appeared to be just copy and paste. Mm-hmm.
Mr. Gammon, you had a question?
Yeah, I just wanted to add, I 100% agree with Commissioner Phillips, his direction, but, one of the things, I'm new to this committee 100%, so I'm going to listen. I don't want to talk too much, but on this issue, I've got 11 grandchildren. So, yeah, it does concern me, but the kicker I've been involved some form or fashion for 20 years with the school system and worked with them, SRO program and all this directly. And so the change is coming. What I see is it's not always whether you are acceptable to it, but I'm like Commissioner Phillips, I am not acceptable to this group. But also, we work for the citizens, and I don't hear the demand for an alternative situation here. That's the kicker. If there was such a demand, we'd all be hearing it, I think, in a lot of ways, and plus, you'd have this place filled up tonight if there is. Now, when that day comes, we'll have to look. But the problem is, I've done some hard studying. Commissioner Gurley said, we just got some of this stuff, and I'm new. But I've done a lot of reading the last few days, and the studying I've done, even in Middle Tennessee, is a lot of the charter schools have gone belly up in 5 years. And so where are we at that point? And they're going to take millions and millions of dollars out of the tax base. And there's pros and cons to it. But the other side, we don't have control of their agenda, of what they teach. I don't think teachers will be, if they choose to go that way, I don't think they're going to be treated fairly. There's no control over what's going to happen here. So my issue is, if the citizens really want something like this, but they got to meet a certain criteria, then there we go. But let's hear the citizens, if they want it, speak up.
Mr. Key?
Do we need to fortify our case in order to deny this? Is it so many issues within this denial makes us have a stronger case?
We've got the information that we put into the original denial, and now what we'll do now is send that back to the Charter Commission. Okay, now it would really help if, like I said, we can get this, put some more things in this resolution to identify those things that we already have in our denial letter.
Is it subjective whether they accept this letter or not, or what's it based on?
On the resolution or the denial letter?
The denial.
I think it's the appeals process. He's trying to be clear on what happens during the appeals process, what's next,
Right.
and who decides.
Yeah, on the appeals process, the commission is separate from their board, okay? So when we denied that, they sent it back. They sent their reply to the commission, and the commission is requesting those bullet points that we identified as being faulty within the application.
We have some examples of a precedent where it's been denied, and we've looked at
Yes.
the cases, perhaps. Okay.
Commissioner Gammon?
I want to add
And
one
then
more
Commissioner
thing. It's
Cook.
my understanding that they can pick and choose who they take.
Yes.
So the kicker is they're going to go through this list, and I understand that. People do private schools and all this, but they're going to pick the best they can pick, and they're going to leave the rest of the people sitting behind. And everybody deserves an equal education.
Agreed.
Commissioner Cook, did you have something? No. I am, and really, since the language is still in flux, I think more than anything, I want a resolution in support of the idea, and then when the actual language is provided to this body, then we can decide if we feel like it needs edits at that point. But so yes, I would like a motion to support the idea of a joint resolution supporting this.
So the motion should be something like this, to move to approve the resolution as may be amended.
Yes, yes.
November
10th,
County Commission meeting?
yes. November 10th, Mr. Sprelick, is that date.
That's correct.
Okay, well, and here it says 18th. So,
Does it say
yeah,
18th?
so November 10th is when we meet.
November 10th.
Second.
November the 10th, yes, sir. Okay. Is there a second for that?
I seconded.
Very good. Commissioner Blue. And so just to go on the record, let's go ahead and just do a roll call vote.
Mr. Key?
Yes.
Mr. Gammon?
Yes.
Yes.
Mr. Phillips?
Yes.
Mr. Cook?
No.
Commissioner Blair?
Yes.
Chairman Allen?
Yes, thank you.
All right, next, Mr. Lee's going to go over our
We've been asked to start a little bit early this year. So I want you first to understand this is not the final draft. This is early. Typically, y'all don't begin to see this until January or February. So what you see today is we've gone through and taken out the projects that have been approved either by ESSER or through the 177 fund, our typical funds. So those projects that we're working on this year have been removed from the list. We've added to the list what we're aware of now. The biggest increase that you see, or that you're going to see, is in our HVAC. projects. When we met last year, we told you that we were going to be going through an EESI program to procure consultants to be able to go through and look at all of our schools to help us address the needs that we thought we had and exactly what those issues are, and to map out a plan for the next 10 years. What you have before you and on your iPad is their recommendation for the 10-year plan. We basically have 34 schools over the next 10 years that are going to be needing major HVAC replacement and or upgrades. Their budget at this time is around $125 million for those 34 schools. What we have done this year, and we started last year, originally we were doing a 3-year look ahead. We started last year at this time with a 5-year look ahead. So we've continued with the 5-year look ahead. I've taken their recommendations and put them in the years that they show with the issues that we also know that we have. In December, Mr. Beaudry and myself will be sending out our capital projects principals request list for each school. The very last line item in this is the principal's request. It was $1.4 million last year. I'm just carrying that number as a placeholder right now. Once we get all of that information gathered together, then I'll either amend that number up or down, depending on where we sit. And once the funding is approved for the 177 fund, what we do is, like we've done in the past, we will take that dollar figure and then we will prioritize the items on the list, and then we will bring that final list back to you. But this is an early look at what we're looking at for the next 5 years.
And this is purely maintenance. This is not...
This is all capital projects. Yes, ma'am. Maintenance.
Does your principals list their wants
Yes, ma'am.
in 1, 2, 3 order?
Yes, ma'am. They have 2 forms. We have a Fund 177 form, and then we also have a general purpose form. There's things like painting, for instance. Typically, painting we don't do out of the capital projects. That's more of a maintenance type item. So those requests would go in our general purpose budget under maintenance. The bigger ticket items like, let's say a school needs a canopy. We had a number of canopies in there last year and they're typically $30,000 to $80,000 depending on what they are. Those type items would go in this budget. So that there's 2 different pots, for lack of a better term. Some is general purpose and the other is capital projects. And a lot of times the difference, if they fit in both categories, is the dollar cost. If we have, and I don't want to use a $10,000 as not being a lot of money, because it's a lot of money to all of us, but kind of that $10,000 range is kind of our cutoff. If it's 10 or less, we try and put it in general purpose. If it's over 10, we typically consider it a larger project and we put it in capital projects. So I wanted to get this out a little bit earlier this year for you folks to look at. Commissioner Allen had asked that we do that. So over the next few months, if you have some questions, please feel free to call. I'll be glad to talk through it over the phone, or if you've got time, you want to come sit down with me, I'll be glad to sit down with you. Because it is a lot of information, and a lot of this, it's a big number. And it's something that over the next 5 to 10 years we're going to need to look at, and it's something that we haven't done in the past, is look 3 years out, 5 years out, 10 years out. We're trying to plan further out now.
Commissioner Gurley?
Yeah, I'd just like to thank you for the Goose Pump at Stewart's Creek High School. You know what I'm talking about.
Yes, sir.
It just needs electricity, and
that problem, that was a capital project.
That was a capital project for sure, and well, the goose excrement is much less than it has been in previous years because the pond was drained, but that's going to make it a lot. I can't see how it's really safe with kids walking around in the stuff all over their feet and then tracking it into the schools. It's got to be a nightmare for the janitors too.
Yes, sir.
Commissioner Key?
Thank you, Madam Chairman. So I know that we have established that we are proponents of career and technical. In our CTE program, and this may be Director Spurlock's question, do we have a HVAC program?
We do not yet. That's one of the programs that's coming.
Okay,
In
we've
the-
got 34 facilities that are about to need this. Is there a way to utilize students for any of this, hands-on, any type of apprenticeships? I mean, we've got a golden opportunity here in the next few years to maybe implement some of that.
I thought we had HVAC at Rockville.
Yeah, we do have the MEP program, and quite frankly, we could use another one. You know, it's hard to find, and what we're going to have to do is start looking out, doing things a little different in terms of finding teachers to do this. Maybe find retirees and contract them out to come in and teach specifically that hands-on stuff. But yes, anything that we can do to get our students where they can have make application to what they're learning, we're all for it. That is a huge program, and we do have one at Rockville High School, and we have one over at Smyrna High School, and we had one at Laverne. However, we lost the instructor. Mm-hmm.
I do know too, and I'll just add this as a footnote, commercial HVAC and residential HVAC are not the same animal. And so in terms of trying to teach students, it's really two different things. The other thing though is we do have the TCAT. We've got the local technical college that I'm sure we could probably see if we can provide some sort of a apprentice opportunity, for them, so. And then the other footnote that I'll add is, I know from our standpoint, from just our personal heating and air business, we've seen 3 price increases in equipment this year. That's unheard of. And there's another company that's potentially about to do a 4th price increase in 1 year. So the 125 that we're seeing today, that is not a firm number at all.
All right, this Thursday, I don't know, 10 o'clock? 10 o'clock, we've got a ribbon cutting at Laverne Middle School. Yes, ma'am.
Day after tomorrow.
Okay, day after tomorrow. All right.
That's for the annex, correct? The annex edition?
Yes, ma'am.
Yeah.
For the annex.
Mm-hmm.
And that HVAC price, that's the other thing that you'll see. If you look back at last year's, the schools that were on the list last year may have had and I'm going to use a number, $1.5 million. Well, that number's closer to $3 million this year. And that's the increases that we're seeing in the numbers that I received. I'm with Commissioner Allen. It's not just HVAC. It's across the board. The Buchanan Sewer Project, we had pipe ordered, and it's a special color because of being underground and a force main sewer. We can get the pipe, we just can't get it in the color that we need it. So there's an alternative. We're going to have to lay a tracer tape that is the right color on top of the pipe. So it's changing daily on what you can get and what the cost for it is.
Commissioner Gurley?
No, I was just going to make a comment about what I saw in my 3,500-mile road trip recently. Gas prices, probably about the cheapest in the country, right around here. I think the most I paid was like $3.75 in some other states, but yeah, it's coming.
Any other questions for school?
Thank you all.
Very good, thank you. Yes, Commissioner Phillips.
I hesitate to bring this up, but Mr. Spurlock, you were talking about working with our legislative delegation on maybe some additional language to that charter school concept and program. And if it's possible, my 2 cents worth would be that there has to be a need for a charter school before they can even make application. And undoubtedly that doesn't exist because these folks were able to make application in Rutherford County. I'd like for I'd like for the school board to also address that. We shouldn't have to be going through this because I don't even think they meet the criteria to make the application. So if our legislative delegation could pay some special attention to that, we may not have to face this year after year after year unless there's a specific need. I don't see that in Rutherford County. I can't for the life of me see that in the future of Rutherford County. It may. And I'm just trying to make this commissioner's position perfectly clear. There has to be a need before that process can even make application. And the way I understand the guidelines is that there is no need in Rutherford County. We have a school system that is A+. So why in the world could they even make application? And I think if we could get our legislative delegation to address that, if they can, it would be a big help to us moving forward. We wouldn't have to go through this.
You know, it's kind of perplexing earlier this year when the Commissioner of Education came out and the statement was, look at those counties that currently do not have charter schools. So I don't know, that wasn't a need. You know, obviously there probably are some counties that perhaps need a charter school, but that's not a need. And quite frankly, I would tell you that, you know, there's some things that we could, you know, like for example, Williamson County had an application. It was for autism. You know, and I think that's a need. You know, I really do. But in their application, you know, it had nothing about need, and we'll just leave it there. All right, thank you.
Mayor, do you have anything for this committee?
No, ma'am, not tonight. Thank you.
There's no other business. We stand adjourned. Thank you all.